If you've been diagnosed with the inner ear disorder Meniere's disease or know somebody that has, perhaps your world has been turned upside down. The doctor may have said, there's nothing we can do to cure it. We may be able to alleviate some of the symptoms, or potentially we might have to have some drastic surgery. If you have been diagnosed with Meniere's disease, you might feel like you've got a lot of financial and family problems ahead with this waxing and waning degenerative condition. You might not be diagnosed with Meniere's disease at all, and it might be something else. But if you have been diagnosed with Meniere's disease, even though it won't kill you, you might feel like you want to die. In 1861, when bloodletting was a common treatment for many diseases, a French doctor called Prosper Meniere proposed a radical and revolutionary new theory. Prosper Meniere proposed that vertigo, a sensation of spinning, tinnitus, a loud hissing in the ear that nobody else can hear, hearing loss, and a sense of pressure in the ear, kind of oral fullness, was in actual fact an inner ear condition. It wasn't a brain-related condition or some kind of epilepsy that was universally thought at the time. It was decades later and long after his death that doctors stopped ridiculing Prosper Meniere and started taking his work seriously. And that is the man that the disease bears his name.
Self-portraits show Van Gogh with one ear, reminding us that he along the way cut off the other one. But his doctor's diagnosis that he was mad may have been way off the mark, and it might have been something far different from madness that drove the great painter to such an extreme act. The principal author of the new report is Dr. I. Kaufman Ehrenberg. He's an otologist from the Colorado Neurological Institute and the Swedish Medical Center in Denver. And Dr. Ehrenberg is with us this morning. Good morning.
Good morning, Paul.
What prompted you to study Van Gogh's letters in the first place?
Well, I started in undergraduate school. I took an art course, and I read his letters back then. And one of my best friend's mothers in high school had Meniere's disease, so I was familiar with the symptoms. And it was obvious that he had Meniere's to me. I didn't do much with it until 1980, and one of my patients who required surgery, had failed medical treatment, was an artist. And I told her prior to her surgery that she was luckier than Van Gogh because we may be able to help her, but there was no help for Van Gogh's Meniere's disease. And she didn't know anything about that, and so she started reading the letters, brought them back, and we decided that we should set the record straight that he really had Meniere's disease and not epilepsy, and he wasn't mad.
So what from the letters led you to believe that it was in fact Meniere's disease?
Well, Van Gogh is very articulate, and he wrote voluminously to his friends and family. And in these letters, he described his medical illness. And in making the diagnosis of Meniere's disease, the history is very important, even today, although we can corroborate it with special testing. The history is very important, and he has all of the important features of Meniere's disease.
Explain to us what those are. We can actually take a look at what the inner ear looks like here.
Well, Meniere's disease is a disease of the inner ear, and this is the hearing part of the inner ear, and these are the balance canals, and they're connected by inner ear fluid. And in Meniere's disease, the patient has attacks of vertigo and dizziness, and these can be associated with nausea and vomiting. They also have a sense of fullness or pressure in the inner ear, and they experience tinnitus or ear noises, a ringing or buzzing type noise. Also, in the early stages of the disease, they have a hearing loss which fluctuates and can go back to normal. As the disease progresses and they have more attacks of vertigo, they tend to have a more permanent form of hearing loss.
In his letters, did he try to self-diagnose what he had?
Well, he was very concerned about the problem that he had, and he wanted to have a better understanding of it. He was aware that the inner ear may be involved, and this was pretty perceptive in the 1880s.
How do you treat it?
How do we treat Meniere's? Most patients, approximately 80%, can be successfully managed on a medical treatment of low-salt diet, diuretics with potassium supplementation, mild vestibular suppressants, if they're over 60 vasodilators, and we ask them to avoid caffeine, alcohol, tobacco, and stress.
So you say the condition can be managed. Does that mean there is no cure for this
There
condition?
is no cure for the problem. There's a lot of different causes for the buildup of fluid in the inner ear. Now this is the inner ear that we just showed as opposed to the middle ear. And the inner ear normally has fluid just like the eye has fluid. When the intraocular pressure goes up in the eye, the vision goes down, and that's basically what glaucoma is. If the inner ear fluid pressure goes up, it can cause balance problems. If it goes up rapidly and ruptures membranes inside the inner ear, that causes the acute violent attacks of vertigo and the associated hearing loss.
Dr. Ehrenberg, thanks for giving us a new insight into Van Gogh's history.
Thank you.
13 minutes before.
In 1938, in England, two researchers called Hall, Pike and Carnes, and in Japan, a researcher called Yamakawa, independently reported that patients that had Meniere's disease-like symptoms during life, in autopsy, had ballooned and dilated endolymphatic spaces. This phenomenon was to become known as endolymphatic hydrops. Dr. Hall Pike was to found the Bahraini Society in honor of his friend Dr. Robert Bahraini, who won a 1915 Nobel Prize for his work on the human vestibular system and the discovery of the caloric testing system, something that people with Meniere's disease may be familiar with. Over time, and many reports later, this concept emerged that people that had Meniere's disease experiencing vertigo and hearing loss was because their inner ear membranes were rupturing, and that rupturing led to a mixing of inner ear fluids. That became the medical dogma, and that medical dogma still exists today.
Meniere's disease is characterized by tinnitus and ear fullness that is followed by severe spinning attacks that last hours to days. It is hypothesized that Meniere's disease is due to an abnormal increase in fluid within the endolymphatic chamber found within the inner ear. Here we have the endolymphatic chamber in green and the surrounding perilymphatic chamber in blue. The vestibular membrane separates the endolymphatic from the perilymphatic chambers. The fluid within each of these chambers are different and kept in a stable equilibrium. However, for unclear reasons, patients with Meniere's disease will start to suffer from excessive fluid buildup within the endolymphatic chamber, causing the vestibular membrane to start stretching. When this happens, symptoms of ear fullness and tinnitus occur. Should enough fluid fill the endolymphatic chamber, the vestibular membrane will eventually rupture, causing the fluids between the chambers to mix, resulting in symptoms of spinning dizziness, also known as vertigo. Over hours to days, the vestibular membrane will slowly heal back together, and the fluid within the endolymphatic and perilymphatic chambers will convert back to normal, resulting in restoration of normal hearing and balance. In order to prevent fluid from building up in the endolymphatic chamber, patients are often instructed to avoid salt, caffeine, and alcohol. Diuretics may even be prescribed in order to help prevent fluid buildup. Should medical management fail, surgical intervention can be performed. With endolymphatic sac decompression surgery, the bone around the endolymphatic sac is removed and a shunt placed to physically drain fluid out of the endolymphatic sac to prevent excessive fluid buildup. In another variation of this surgery called endolymphatic duct blockage, bone is removed around the duct and a clip placed to prevent fluid that is produced by the sac from building up in the rest of the inner ear. Finally, if vertigo is still not well controlled, the nerve going to the inner ear balance system can be cut surgically. Alternatively, special drugs can be injected into the inner ear to chemically destroy the balance system.
Almost every aspect of Meniere's disease is controversial. It's not like a doctor can look in at the inner ear in the same way they can look at your skin, for instance, if you go to a dermatologist. Richard Gasek, he believes that the Meniere's attacks are a virus reactivating on the nerve. Other, more recent reports, however, are suggesting it's a mechanical process and there's a disturbance of the valves that control the inner ear fluid. So what really causes the attacks in Meniere's disease? More recently, it's been suggested that the medical dogma is wrong.
Meniere's disease affects about 46 out of every 100,000 people, but some studies from 1954 up to 1995 also report figures anywhere from 16 to 200 out of every 100,000 people. These are mainly Caucasians. There is a slight female and familial bias, with the onset of ages around about 30 to 50 years, mostly. Up to 65% of people with the disease will become bilaterally symptomatic, essentially meaning it will affect both ears.
Now, although the idea has been around for decades, the endolymphatic sac is critical in Meniere's disease and its degenerating condition. It is the immune defense organ of the ear. It controls water transportation within the ear, and failure of the endolymphatic sac can lead to eye drops. It can be difficult for people unaffected by Meniere's disease to fully understand how debilitating the condition can be. Doctors are often very confused in how they can best help their patients. Along with the standard Meniere's disease symptoms, there's often other issues such as diabetes, higher risk of cardiovascular disease and stroke, allergies, and also immune issues that often travel with the condition. It's no wonder that there's confusion and myths abound about Meniere's disease and endolymphatic eye drops and how to properly treat it. It seems there are endless ways to treat Meniere's disease, but one thing is clear, it's not a one-size-fits-all approach. You've only got to be looking at some books and the internet to work out that there's people that think it should be diet restrictions, it should be surgery, it should be exercise, and a whole series of other various different disparate treatments that are currently out there. And the internet, it's compounded that problem. Even in today's global village, standard treatment and diagnosis of Meniere's disease is hard to come by. Doctors still have difficulty on finalising a definition. Perhaps it's because the condition resides deep within the skull. The balance mechanism and the hearing mechanism are so exquisitely sensitive. It almost seems that the patient is on their own, and finding an effective treatment is almost impossible.
Infovideo.